The child undergoes general anesthesia with the help of the anesthesiologist and his team, and once the child is asleep, sterile precautions are taken to ensure that there is no chance of infection, and everything is prepared in a scientific way, and then the child undergoes the surgery. Standard techniques that are applicable all over the world is the same technique that we use, and hence the results are also exactly the same as throughout the world.
ನಗುವೆ ನಿನ್ನ ಆಸ್ತಿಯು ನೀನೇ
Once the child is operated, the stitches have to be removed on the 7th to 8th day, and the child comes back after discharge for suture removal. Once the stitches are removed, we allow for the healing to take place completely and the scar to settle down. And as the scar settles down, we follow up with the child to see how the growth is. We ensure that the face is growing normally, as is the child on a general basis, and they are going to school and attending and doing all the things that children are normally supposed to do.
ಮೊದಲು ಆಪ್ರೇಷನ್ಗೆ ನಮ್ಮ ಹುಡುಗ ಚೆನ್ನಾಗಿ ಕಾಣಿಸ್ತಿತ್ತಿಲ್ಲ, ಎಲ್ಲರೂ ಹುಡುಗರು ಚೆನ್ನಾಗವ್ರೆ, ನಮ್ಮ ಪಾಪು ಚೆನ್ನಾಗಿಲ್ಲ, ಏನೋ ಮಾಡೋದು ಅಂತಂದ್ಬಿಟ್ಟು ಅಂತ ಇದ್ನು. ಈಗ ಆಪ್ರೇಷನ್ ಮಾಡಿಸ್ಲೆ ಚೆನ್ನಾಗಿ ಕಾಣ್ತಾನೆ, ಇನ್ನೊಂದು ಸತಿ ಮತ್ತೆ ಕರ್ಕೊಂಬಂದು ಮಾಡಿಸ್ಬೇಕು, ಚೆನ್ನಾಗಿರ್ತಾನೆ ನಮ್ಮ ಹುಡುಗ ಅಂತ ಇವಾಗ ಖುಷಿಯಾಗದ. ಆವಾಗ ಖುಷಿಯಾಗಿರ್ತಿಲ್ಲ ನಮ್ಗೆ, ಈಗ ಖುಷಿಯಾಗವ. ಆಪ್ರೇಷನ್ ಮಾಡ್ತಾರ ಚೆನ್ನಾಗಿ ಕಾಣ್ತಾನಲ್ಲ, ಅದಕ್ಕೆ ಇವಾಗ ಖುಷಿಯಾಗವ.
ಮಗುವೇ ನಿನ್ನ ಬಾಳಲಿ ನಗುವು ಎಲ್ಲ ನೀಡಲಿ, ಖುಷಿಯ ಕಿರಣ ನೀನೇನೆ, ಬೆಳಕ ನೀಗೂ.
The most important step in the management of cleft lip and palate is not only treat but also preventing the development of cleft lip and palate. Hence, we plan to initiate a program in collaboration with RBSK and Government of Karnataka to ensure that every woman of childbearing age would be nutritionally supplemented with B12 and folic acid as an additional supplement over and above dietary changes that we will advise. This will lead to widespread nutritional support of all the young women of the state, which will ensure that when they get pregnant, the likelihood of getting a developmental malformation like cleft lip and palate is reduced. This will also bring about awareness amongst the families how nutrition is extremely important in preventing birth defects.
Whenever you come across such sort of issues, maybe a defects in the birth defects in the children, you can have the assistance from our health team, which is placed at the district level, or directly you can also contact with the IHF. They have got a facility to address all these issues. Kindly, my request is to make use of these services very effectively and ensure that our kids never suffer from this type of defects in future.
Inga Health Foundation is uniquely focused in treating children not only with cleft lip and palate deformities, but also children who are born with deformities affecting the skull and the facial skeleton. Now, such deformities, especially the skull deformities, can vary from the eyes being too far apart, called hypertelorism, to growth centers of the skull being prematurely fused, leading to abnormal shapes of the skull called craniosynostosis, and even rare clefts affecting the skull and the soft tissues, which can go anywhere around the orbit, called Tessier clefts or craniofacial clefts. Apart from this, Inga Health Foundation also treats all varieties of facial deformities, ranging from abnormalities of the facial skeleton like hemifacial microsomia or temporomandibular joint ankylosis, or even reconstructing a missing ear called microtia repair. All these craniofacial deformities come not only from the state of Karnataka but from all over India and are treated completely free of cost by Inga Health Foundation. Apart from the main center in Bangalore, Inga Health Foundation also has centers in Navi Mumbai and in Srinagar, Kashmir.
ಮಗುವೇ ನಿನ್ನ ಬಾಳಲಿ ನಗು ಎಲ್ಲ